Hello, everyone. I'm Jonathan Cain, co-founder of the COVID-19 Global Hackathon 2.0, Social and Mental Health. And welcome to today's webinar on mental health tech in 2020. 2020 has been quite the year, a bit of an understatement. Speaking from the parochial perspective of someone from the US, as the year careens through the pandemic and toward the election, there's no reason to think that the future is going to be any less interesting and challenging than the past. For all of us, the past year has presented considerable challenges, but also unexpected silver linings and opportunities. And I hope that as we go forward in the future, we're all able to help each other find more ways to focus less on the negative and more about how we can find and build positive things in our lives and in the world's. In places like the US, rates of depression have tripled since the pandemic began. More than half of all adults report they're struggling with a mental health disorder. And 1 in 4 young adults have actually considered suicide in the last month. Yet, we're also seeing interesting positive indicators, such as how anxiety rates among some teenagers have been declining due perhaps to the unexpected shift away from oppressive industrialized schooling. And so with the recent COVID-19 Global Hackathon 2.0, we hope to help projects focused on second and third order effects of the pandemic. And what we saw was a powerful focus on facilitating connection between people. And we're delighted to share with you a number of hackathon projects that use technology to facilitate such experiences. The future is, of course, unknown, but in order to navigate the changing world as effectively as possible, I urge everyone to find ways to connect more deeply with yourself, with family, with friends, and with strangers. Despite the apocalyptic rhetoric that our attention-driven media pushes on us, I also urge everyone to focus on what we have in common through our shared humanity rather than what divides us. And the more that we support and lift each other up, the more we can expand everyone's emotional resiliency and help bring healing to each other and to the world. And so now I'm delighted to introduce my hackathon partner, Danny Friday.
Hi, everyone. It's a good time to be here, and we're really excited to show you what some of the teams have been working on over the past, what feels like, a millennium, but was actually just 5 weeks. We had 116 projects submit to this hackathon, which took place about a month and a half ago. And since then, it's been a whirlwind for these teams who have been extremely hardworking and dedicated to addressing the mental health challenges of the pandemic in their own unique and tried and true ways. Through this event, we're hoping to kind of outline 2 different kinds of dimensions. The common thread among all of these is that these are all technology projects and hopefully technology companies. Going in between or ranging in between spurring social connection and all the way to facilitating and creating infrastructure. And so we'll go into more detail on what we mean by that in a moment. The other dimension that we're hoping to explore is the different ways that you can do this as well. So do you go this venture-backed route, or do you go a more sort of bootstrapped route? Of course, finally, we'd like to address all of the different aspects and second-order effects of the pandemic and go into detail on how these companies are responding and starting given the kind of new normal that we all find ourselves in these days. So with that much said, I'd love to introduce 2 of our speakers and panelists. First is Glen Moriarty of 7 Cups, which is the largest active listening therapy platform in the world. I would much rather he give an introduction to himself because he can do a much better job of speaking to the impact he's having. The other panelist and speaker I'd like to introduce is Arun Gupta of Quartet Health, also a mental health technology company. Yeah, I would love for you both to take it away.
Arun, would you like to go first?
You got it, my friend.
Okay. Thanks, Danny and Jonathan. You guys did a really terrific job, and Grace, you all did an excellent job with this. It's really awesome to see what people can create in 5 weeks. I think that's the great thing about hackathons, right? It's like when you when you have really tight timetables, it really forces creativity, collaboration, and potential greatness. So it's great to see these efforts underway. I'll just share my screen real quickly to talk a little bit about Seven Cups and to share more of my perspective from a funding perspective as well. So hopefully you all can see my screen. So on a high level, like Danny said, Seven Cups is an emotional support system, and it really has 4 components. So we have 430,000 trained listeners that provide support in 140 languages across 189 countries. Since the pandemic has started, that's grown by almost 100,000. So it's significant. The community is a global community, but we have sub-communities also. So people that work together to support each other overcoming depression or better cope with anxiety. Third part is treatment plans. So if you go see a clinician because you have panic attacks or social anxiety, they'll use a CBT protocol to help you do manage that better, and that's what these are. And then the last part is licensed professionals, so psychologists, social workers, therapists that are on the platform and provide care. 99.8% of what we do is at no cost, but 0.2% of people upgrade to talk to a licensed professional. And really what we see here broadly is it's just rising demand. We see mental health largely and behavioral health as a supply and demand problem. There's huge demand, and this is increased by the CDC was out with a recent article on the impact of the pandemic. It's really rough. And so I'm a psychologist, my wife's a therapist, but if we can't make enough clinicians, we can't train enough people to help the amount of people. So on Seven Cups, we take a volunteers plus clinicians plus tech approach to scale our ability to support and help more people. And over the years, we've reached about 53 million people. So the last question they asked us to consider was bootstrap versus the VC. And it's great that Arun's on the call because you've got 2 ends of the spectrum. So Seven Cups raised $2 million in seed money coming out of YC from a host of great angels, really smart folks we're honored to be working with. I think the number one thing you have to think about is, are you impact first or are you revenue first? So if you're gonna go the VC route, you probably need to be revenue first. So if I've checked out the videos and some of the sites, if there's an emphasis on more of a social impact track, it might be harder to find a VC to fund that. Not to say it's not impossible, but it might be harder. The other thing I would have people think about is Silicon Valley is a system. A university is a system, an employee, a job is a system, a company is a system, and the Valley is also a system. So you need to understand when you're in it in the founder role, it can be helpful to kind of zoom back and look at the other players and how the system interacts to better see how it operates. And part of that is understanding VC as a financial domain in terms of when you compare it with the stock market or art or whatever else. It's a relatively small amount of money. And as an asset class, it doesn't have amazing returns. So it consistently loses a lot of money, but it's not just the firm. So every firm kind of raises money from limited partners, and then they try to make those limited partners money, but it's really not. There's certainly, world-class firms, but the thing to really pay attention to is more so the partner than you want the right partner in the right firm, because I think I read a study, it's about 100 individuals that really matter, that really drive the significant returns. So be careful about just getting VC, be careful about getting VC from a particular firm. You're really, really smart because it is a marriage and there is no option of divorce. So you are locked in one way or another. And the last point is just be very mindful of the end. There's an exercise you can do with folks where you say, hey, where do you want to be at the end of your life? You can, if 80, 90, 100, however old you are, what do you want people to say about you? So think about your end state as a company. What would be the ideal place for you to be? What would your potential investors, what would your potential employees, what would your potential people that are associated with your company, your users want? And whatever that is, if VC is a route that can help you get there, fantastic. If not, then I think now is a particularly good time to be thinking about new models, new ways, new possibilities, new opportunities for funding that I think are particularly relevant now as we begin to grapple with the world we're in, and the fact that we really have to strengthen our social fabrics in ways that are not necessarily tied to capital, but towards really looking out for each other. So I'll stop there. Thank you.
Arun, please introduce yourself.
Thank you. That's awesome, Glenn. I'm going to try to keep the remarks short so we can get into these awesome projects. And thank you all for having me. And just, I had a chance over the weekend to get read in on some of the projects that have been going on in the hackathon. And just awesome stuff. I do believe for everybody, participating right now, there's no better time, certainly in my entrepreneurial career, to be building companies, in this space. I very much came at this space from the social entrepreneur sort of mentality of, tech, as maligned as it has sometimes become, today. I do believe tech is a fundamentally innovation enabling force that could create scale and access and data-rich ecosystems, all these things that we really needed to fundamentally change mental health in our society. And specifically, we launched Quartet back in 2014. We did very much, per what Glenn was alluding to, go down the venture-backed road, which I'm happy to talk about. And over the last 6 or so years, we've grown to 300 some employees. We raised probably over $150 million through a couple of rounds of financings. And we've scaled a nationwide SaaS business model. Hopefully one day we'll even be global, and we've had some explorations in that vein. Specifically, what our company has done is really work at integrating mental health into the general medical ecosystem, and frankly elevating the mental health needs of patients and the mental health services that mental health providers can offer. And the way we do that is through a platform that's a multi-user ecosystem of primary care, sort of general practicing physicians on one side, mental health practitioners on the other side, and patients, of course, in the middle. And all those parties interact through our system to both more proactively surface mental health needs that may be underneath issues that are presenting in the general medical system, and then to surface various different options for the patient to engage with the right sort of mental health care, and then curating all that through against outcomes data. We track lots of closed loops on outcomes. So our company, and part of why we went the venture capital road, is when we set out, we said, we really want to systemically change the way mental health is viewed in our society and our medical system. We knew we were going to need to build very complicated data technologies around ingestion of claims and medical record data, and supervised and unsupervised machine learning and programmatic learning programs. We knew we were going to have to build multiple user, front-end apps for the mental health providers, for the patients, for the primary care physicians. And we were going to monetize all of that through the insurance companies. And so that was just a lot of things to really endeavor to go do. It's what we thought was needed, and it's worked out well for us. And so it made a lot of sense to kind of go big, secure capital, and have the opportunity to really build, those pieces of technology, such that when we went to the market, in each passing year, we had invested against building the things that we needed to show that this was the right way to handle the issue, and that we could create a lot of value by way of getting patients more access to mental health care, and showing over time that not only does that improve their mental health outcomes, it's also now we've shown that it improves their chronic disease outcomes to the degree they have other chronic health conditions. And we've also shown now that it's actually lowered their total health expenditure, predominantly because they're having less of the acute, medical, ER and all that stuff. So there's value in there for the insurance companies to fund the whole thing. And we're able to do all of our work for free for the different user parties. And we have an enterprise SaaS business model with the payer. So it's been a wild journey. I think anytime you go down the venture back road, you sort of got to tie up those running shoes and get ready for a real sprint, because it's, quarter after quarter, the world just keeps coming at you. And there's been a tremendous amount of change in our company. as we've gone. We've been able to build a very mission-centric company, despite having, revenue and profit motives. And so I'm happy to talk about some of that. But I just do think at this moment in time, there's no better time to be building this stuff. I think 2020 and the COVID pandemic has forced the healthcare system into a whole new world. And I think things that are getting built now, sort of like happened with mobile native companies, in the late 2000s into 2010, sort of like has happened now with cloud native technologies. I think healthcare is going through its digital native moment. And the whole healthcare system is trying to graft, traditionally in-person and sort of traditional models into a mobile or telemedicine or technology-enabled care form. And I think, like happened in those other spaces, companies or products that are built more native to this new world are really going to have an opportunity to leapfrog. And I'm seeing that in terms of what the payers are willing to do. I'm seeing that with our mental health providers and our primary care physicians. So again, happy to talk about any parts as we get to the Q&A, but I'm just pumped that this event is happening. I think, the silver lining or the opportunity that's coming out of this awful pandemic is that I think mental health is in focus. And I think a lot is on the table for entrepreneurial folks to build against.
Thanks, Arun and Glen, for describing the landscape as it exists now. And so next, before we dive into roundtable discussion with a number of the hackathon participants, I want to share with you a series of short videos that we produced about the top projects to give you a sense for what they're working on, so that we can then spend the discussion time focused on that. So the first is Care Cards, which is a collection of card-based interactive psychological tests that help people learn more about their emotional state. It's essentially a pre-diagnostic tool to help lower barriers to accessing mental health services, whether tests or techniques to help individuals improve their resiliency or to better facilitate receiving professional care.
6 years ago, I didn't feel like myself anymore. It got up to a point where I nearly couldn't cope with my everyday life. At this point, I knew something needed to change. And so began a 1.5-year-long journey. A journey where I denied, felt ashamed, and isolated myself. And when I tried to get help, it was hard to find a specialist. And it was even harder to get an appointment without waiting 2 months or longer. And those appointments would most times end without any follow-up help, because answering difficult, hard-to-relate questions watched by a strange person in an uncomfortable clinical setting and getting results I couldn't understand made me often walk out ashamed and frustrated. And this is one of the reasons why over 57% of adults and 59% of youth do not receive the mental health care they need. In average, the waiting time for psychological help in the USA is 50 days or longer. But there was one very important thing I learned. I was not alone with my problems, because over 46% of Americans suffer from mental problems throughout the course of their lives. And I knew this situation had to change. Fortunately, so did my founder colleagues and came up with an amazing idea. And together, we built our mission on this idea: early identification of psychological problems and accessible mental health care for everyone. And due to my personal journey, I was able to experience the main problem points firsthand. Strong stigmatization, inefficient and costly processes, long waiting times for appointments, uncomfortable long testing procedures. Now, these individual problem points lead to a much larger sum of problems for our system. Extensive annual costs related to mental problems, collateral and social system damages, long average incapacity to work, followed by economic production losses. We at Care Cards want to change this situation with our solution. And that's why we have developed an accessible interactive platform that offers personalized, intuitive psychological self-reported tests and immediately recommends and connects with suitable follow-up resources. By combining gamification and user experience design, we create an interactive and fun experience. This makes psychological testing easy, intuitive, and even fun. We combine mechanisms like swiping with a unique graphic translation of the test questions. The experience is completed by an individualization for the user, which helps to identify even better with the presented emotions. With care cards, my 1.5 years journey would have been shorter, and I would have saved myself several. And the system could also have saved a lot with an early test by care cards, because early detection can reduce overall healthcare costs by 20%, increase productivity costs by $2 to $10 per person, and gain an extreme amount of quality life for the affected person. And this only with a small investment between $2 and $12 per test, result, and follow-up recommendation. Due to existing infrastructures, we will enter the B2B2C segment initially. Our initial target market are children, young people, and their families. We already have clinics lined up to use our prototype in their facilities and therefore allow us to test and validate the product in different environments. The initial distribution will happen by the founders primarily. Potential partners include schools, medical institutions, or insurances. Our initial focus in marketing is completely on brand awareness. So if we are just focusing on kids between the age of 2 and 17 years and their main issues, we are looking at more than 16 million affected people already. Our 5-year goal is to at least early identify 5% of them per year with care cards, which leaves us with a minimum revenue of $5.9 million if we only cover the above issues. And to make this happen, we are looking for an investment of $500,000. If you want to shape a future together with us in which mental health is available to everyone, and you want to reduce not only stigma but also costs for the system and participate in a consistent growing market, especially in the times we're currently facing, then learn more about care cards and reach out. Thank you for listening.
Thank you. And next up, we have Big and Mini, an online platform that connects seniors or bigs with young people or minis to share life lessons, experiences, and stories.
Hi, I'm Alan.
I'm Aditi.
I'm Anthony.
And we're the co-founders of Big and Mini.
63% of Americans report feeling lonely. At Big and Mini, we're changing that.
Imagine a world where a 70-year-old writer meets a 19-year-old English major. 2 months later, they're still calling weekly and bonding over everything from recipes to Shakespeare. That's the reality for Carol and Avery, a Big and Mini match.
Big and Mini is a platform that creates meaningful, authentic connections that link generations together virtually to share stories and combat loneliness. Through dynamic group activities and one-on-one matches between seniors, bigs, and young adults, minis, we create a community working together to spread wisdom and social isolation and make everyone's lives a little better.
Now, more than ever, connections and togetherness are concepts that seem obsolete. The world has stopped moving. Everyone is staying home. It's easy to feel helpless right now. This pandemic has fundamentally disrupted the ways we traditionally connect, causing levels of social isolation to peak, especially among older demographics. In the elderly population, nearly half of all seniors say they constantly feel lonely, while 1 in 6 seniors report being socially isolated. The negative physical health impacts of this isolation have been equated to smoking 15 cigarettes a day, and have been linked to heart disease, accelerated dementia, and even death, making this a crucial issue to solve.
On the flip side, younger generations, in addition to the increased isolation associated with COVID, are facing a sudden lack of mentorship while trying to balance an online education with the difficulties associated with a worsening job market and limited opportunity. Before the pandemic, 3 out of 4 students reported never having a strong mentor in their lives. Now, having guidance is more important than ever.
Big and Mini was born out of a desire to address these challenges. To provide some background, the story starts about 3 months ago when we were sheltering at home because of COVID and we're looking for a way to help. We used to visit nursing homes and care homes and had super rewarding discussions about everything from European history to marine biology. Since this was no longer possible in person, we wanted to create these connections virtually by matching younger and older people for weekly phone and video calls. Now, 3 months in, we've got over 1,500 active users on the platform from 50 states and 22 countries and are growing more every day.
The way our platform works is simple. Interested seniors and young adults can go to our website and sign up. From there, both parties will be asked to fill out a profile, filling in their interests, areas of expertise, and what they would like to learn from their match. After completing a quick screening and training to make sure both parties remain safe, bigs and minis will be matched together with our algorithm based on complementary profiles, ensuring we can maximize the learning and connection gained from these calls.
Additionally, we've built our platform to be incredibly accessible. with one-click video call access, support for users with limited technology, and mobile app and website options. Using technologies like React, React Native, Twilio, and Amazon Web Services, we built our platform to be scalable to ensure that we can connect millions of users.
Thus far, we've seen resounding success in what both bigs and minis are able to get out of this platform. We receive a constant stream of emails and videos detailing the level of connection our matches have been able to make and how truly mutually beneficial the connections we facilitate are. Minis are saying that their big has become their best friend, and bigs are saying their mini is like their own children. People have truly developed deep intergenerational connections with big and mini. These stories are incredibly fulfilling and show us that our platform undoubtedly positively impacts people.
My birthday is next Wednesday.
What?
I don't think we're going to do anything special at all.
Oh my gosh, no, our next call will do something special.
As an organization prioritizing social impact first, we have and will always keep our main platform free to ensure that we can reach those who need big and mini services the most. However, to remain financially sustainable, we've created a software licensing-based model that allows us to apply our matching algorithm to a variety of contexts. From matching residents of senior communities to schools, to matching employees with retirees, we give organizations the option to pay for customized software and metric tracking that makes it easy for them to give their users the value Big and Mini provides. As of now, we have over a dozen deals in the works with a variety of different organizations.
Months since Big and Mini got started, we've had over 300 recurring matches, raised over $20,000, and welcomed a constant stream of new Bigs and Minis. We've been featured in over 40 media outlets, ranging from The Today Show to the Dallas Morning News to Parade Magazine. We've brought together people from all across the world, helping them make lasting connections with people who offer a new perspective, and doing our part to make people feel more connected.
Looking forward, we want Big and Mini to become the go-to site for people from all generations to find connection and reprieve from loneliness while learning something. We hope to continue expanding our organizational model to reach even more individuals at once while expanding our platform accessibility to reach those who may not have access to technology. We plan to do this by creating strategic partnerships with senior living providers and colleges, developing an ambassador program, and using our place as a social impact-focused organization to help provide technological resources with Big and Mini pre-installed to those in need.
Of course, none of Big and Mini's success would have been possible without the hard work of our team and constant advice of our many mentors and supporters. The COVID-19 Global Hackathon 2.0 network has been instrumental in supporting us these past few months, and we're incredibly grateful and thankful for their help.
Regardless of how Big and Mini grows in the upcoming years, one thing remains clear. Our goal will always be to eradicate loneliness, one Big and Mini match at a time.
Thank you. And next up, we have OpenABA, which is a telehealth tool for childhood autism therapists. It uses applied behavioral analysis, which works to improve behaviors such as social skills and provides tools to providers for real-time interaction in specially designed activities.
Hi, we're the OpenABA team. I'm Alex. I'm a fourth-year data science major at UCSD with a passion for social impact projects.
Hi, I'm Crystal. I was a registered behavior technician, turned into web development.
Hi, I'm Yuan. I'm a mathematician by training and a software engineer by day.
Hi, my name is Harley. I'm a board certified behavior analyst. By day, I help children by delivering a treatment called applied behavior analysis. In particular, the kids that I work with live with ASD or autism spectrum disorder. 1 in 52 kids live with autism spectrum, and it impacts their ability to developmentally grow skills related to language, communication, and making social connections with others.
Living in the time of the coronavirus pandemic, people are staying home, they're social distancing. They don't get the opportunity to access as effectively the standard practices of ABA therapy.
As things stand, current telehealth solutions are not conducive to delivering quality sessions. Everything is everywhere. PowerPoint, flashcards, YouTube, reward systems. Things are forgotten and misplaced. Coordination between staff can be difficult without proper tooling.
So the ideal kind of tool for applied behavioral analysis demands a fast, centralized, and synchronized solution to help resolve this clumsiness that's inherent to the current social distanced ABA landscape. So that is what OpenABA is for. With our sessions that digitize the most important elements of in-person therapy sessions, it's very convenient for therapists to start their communication with clients with responsive React-based interface supplemented with video chat via WebRTC. So now we'll check in with Harley and Crystal for a demo to see how our application works.
I'm gonna open the video chat and we'll get started. Hey Crystal, how's it going? So for the purposes of modeling how to best go about running a session. I'm just going to have you pretend to be the student. Okay, well, you know what? I know Finding Nemo is your favorite show. Can you find the clownfish?
Of course.
Oh, careful. Remember, we want to click this one. This one's the clownfish. Can you click clownfish?
There it is.
Nice. There you go. Here, you can give yourself another token. And hey, guess what? You did such a good job. Great work with your activity today. I'm going to give you some kudos. Great. And now we can play a game together. Which game would you like to play?
Jolly Jumper.
Okay. Let's see who has the better high score. Thanks so much, Crystal, for joining me today. I really appreciate it. I'm just going to walk the viewers through the session reporting.
All right, bye.
Thanks, Crystal. So once the session is done, all I need to do for reporting purposes is just simply click the report button in the management panel. Once you click it, you're going to have a breakdown of all the different responses that the student performed during the session, which is perfect if the person running the session has to report to someone else. Everything's automatically graphed, and then if I need to save it, I just click this export button, and it's ready to save as a PDF.
Beyond showing just how our product works, we're happy to share that OpenABA is a thriving ecosystem. We have over 1,100 telehealth users who are on OpenABA. 700 plus of those are registered practitioners. And each week, more than 200 people are actively using our product.
Speaking of which, all these results were only made possible because of a tight integration between the practitioners themselves and our engineers. We've been fortunate to catch people in the middle of a career transition from behavior analysis into software engineering. And that's become a wellspring of product insight, just making the thing that people want. To that point, we found users that have adopted our product at an organizational level in 5 different countries. The only reason why we know that is because people actually email us asking us to provide phone verification for their country's country code. And then in those, we are able to start a conversation. Similarly, that's how we know that we're at least in 5 unique school districts across the United States. Some of them are quite large, again, simply because they reached out to us.
As for our future plans, we don't know what the future holds, but we are optimistic about the potential of this project. Everyone on this project has contributed in a volunteering capacity, and we are happy to maintain OpenABA as a public service.
OpenABA is a solution that's here to stay. It was brought about to fill a need as a result of the ongoing coronavirus pandemic. But we see many use cases for how this can be used when people do return to in-person sessions. OpenABA is a tool for now and for the future.
All right, thank you so much. I mean, all of the participants have done an amazing job with their videos, and we're super grateful for the effort that they've put in, not only into the videos, but into all of the work that they've put in practically over the past 5 weeks in terms of building out their platforms. I'd like to shift gears a little bit and open up the conversation to a lot of the teams here. I know there's a lot of people who need to actually join as panelists, so that may take a moment. But I would like to re-invite Glen Moriarty and Arun Gupta, as well as the entire OpenABA team, Yuan Wang, Harley Lang, Alex Luo. Thank you for that amazing presentation. I'd also like to welcome Bacon Mini. The team there is Aditi Merchant, Alan Zhou, and Anthony Zhou. And then finally, I would like to welcome Care Cards, Dr. Krutika Gohil, Joanna Klinger, and Alberto Hernandez. Once you're all panelists, I'd love to kick off a conversation with everybody here. But firstly, good morning or good night, depending on where you are. Thanks a ton for being a part of this. So I actually want to kick off a question, and then hopefully Arun and Glen, you feel free to jump in as well. But I'd like to hear from one team. What's the last thing that surprised you about your users? Anybody would like to jump in on this one? Perhaps we can start with Big and Mini. How about that?
I would say probably the diversity of users that we have. I know when we were starting out, we had quite a small sector of people that were mainly local to Austin, Texas area. And since then, it's just really spread out to really so many different countries and so many different areas in the world. I think that's just been really cool to see how people have been able to come together from completely different backgrounds, whether that be cultural or something else entirely, and still have that connection formulated.
Nice, thank you. And then anyone else want to jump in? Open ABA, maybe. Would you like to share about some of the things that have surprised you about your users?
The fact that they surprise us would suggest that we didn't know it in advance and that we were too incompetent to have read their minds. But all joking aside, yeah, I mean, virtually everything. I think big ones were, you know, shittiness, pardon my French, of internet connections for a lot of people, particularly in the rural parts of the country. Biggest one is like older people require much more handholding in terms of tutorial materials. HIPAA compliance is one that we kind of were expecting, but there's all these other compliance frameworks that you got to kind of watch out for and be ready to implement. Yeah, does that answer your question?
Yes, it did. Thank you. Also, Glenn, are you on as a panelist now? Are we all on?
Yep.
Okay, fantastic. And then Arun as well. Okay, great, you're here. Yeah, so I know we sent you some of the videos earlier. I'm curious, maybe if you want to start, Glenn, with any sort of reactions or thoughts you had or jumping off points about any of the companies and any questions you want to ask, and then we can also cycle back and forth between you and Arun as needed.
Sure, that sounds great. Just congratulations to all of you. You did a really excellent job. I mean, these are real, I mean, 5 weeks, it's pretty awesome. So really, really good job. And it's clear that you all really care about your users, which is the most important thing, right? You have to really care about your users, and you all really do. You're being very thoughtful. So that's spot on. You know, the YC mantra is to make something that people want. Because right now advertising and internet, like the costs are really too high to acquire users, and the best way to get growth is to just make something that people want to use, and you know, find those people. So one thing I think that ends up being pretty important in this process is acquisition. Is how do you find those users? How do you tell their stories? How do you leverage social media? So just encourage you all to really think about acquisition a lot, but you know, on both sides, on the big and the little side, on the clinician side, on, you know, whatever you know, on the consumer side. I think the other thing I really like about this, all of you, is these are not necessarily simple problems, right? Like addressing loneliness, or helping kids develop better social skills, or psychological testing. As a psychologist who's done a ton of way more psychological testing than I ever want to admit, you know, this stuff is not easy. And I love the kind of the more of the simplicity approach. And the last thing I just say is I think it's good that you all have initial business models that you're working from and that you're operating from. The only thing I would just encourage you to do is try to keep your options open a little bit, especially now as you're figuring things out. There's a really good book out there called Anti-Fragile, and it's written by a guy named Taleb, and it's basically that the more options you have, the more kind of resilient you are, the more you can grow, the more you can learn. The less options you have, kind of the more fragile you are. So right now you're all starting out and you have all of these options. So if you keep doing things that your users love, and you care for them, and you evolve, you might come up with some options or some ideas on how to finance this that are not kind of immediately obvious right now. So my main question for you all is really around acquisition. but those are just my high level points, but I'll pause there and invite Arun to jump in.
You hit it, Glenn. I'll pile on the kudos. I mean, I love these projects. I have proximity to all of them for personal reasons. So like, they're just all hitting me close to my heart. And I think the only thing I'd add to what you said, Glenn, is that let's not be afraid to lead with our hearts and the mission, right? Every one of the problems that each of those three we saw were very profound. They're deep problems. And lead with the mission, not just because it's an effective form for you to lead from, because we're going to need to create very evangelical communities. And like, you're in this early part of your user life cycle where you're touching people in very meaningful ways. Like, you're not just giving them a transactional service. And you will need to learn how to really bottle that up, study it, understand it, simplify it, like multiply it. And the more you're able to lead from your heart and with a mission, you will probably like draw those users in as like almost like a part of your company. Like, you should allow that bond to be a little permeous, actually. I would encourage you to. And then I just think you got to marry all that with like the diehard capitalism of like, we need to find business models. Like, the healthcare space has been, unfortunately, not necessarily the most prolific space for like, booming technology companies, SaaS companies, et cetera. And so like, I think the caution of the yesteryear is just that the same way we iterate on our products, I think like Glenn's saying, we need to think about like, what are all the different parties and sources of value that we're creating, and where can we create relationships to start having, earned income and revenue streams, and testing and iterating our way through that with almost like as much effort as you're applying to your product development exercise. Early teams will tend to spend 90% of their energy on developing their product and building their user base. And yeah, we got an inbound from some B2B, like, who's going to take that? Okay, I don't know. Why don't you guys just take that on Friday night when, we're done shipping, the thing we're trying to ship this week, like, versus, I think making that a big priority and then allowing yourself the time to experiment. Particularly in healthcare, there's oftentimes multiple parties involved. And so figuring out who's actually really going to find the most value in what you're doing and find a willingness to pay for it is a lot more complicated than I think the typical SaaS and consumer spaces. And so you might need to like test and experiment and explore a fair bit, in that way.
I would like to open this up as well for any hackathon teams to kind of ask questions that they may have had in the back of their heads that they've been thinking about as they're going along in this journey. All of that is something we can do here. So if anyone wants to start with any questions, or if it goes the other way around, Glenn and Arun, if you have any questions for any particular teams, you're absolutely welcome to ask.
Yeah, so maybe I can go back to what you said, Glenn. So first of all, it's really nice to meet you, Glenn and Arun, and get your input on that. We have defined our initial target audience as kids and their families with care cards to just support them in understanding the emotions of the kids and see, is there anything that needs attention or that they need to look at or need to take some follow-up steps. And initially we think that it would be helpful for us to actually distribute via schools, educational institutions. So approach them, show them the business case. How can they use that? How can they distribute that to their students? And just give them a tool of saying, hey, if you have the feeling something's going on with you, just check in on your emotions and just play that game. And then we can see if there's something that needs attention. And we've been struggling around a little or thinking about how do we approach that in the best way? Do we go B2C, which obviously needs a little bit more resources in terms of marketing and spreading the word, or do we go that B2B2C road? And we think both approaches could work in terms of, first of all, approaching a lot of individuals, making sure we generate some data, or going directly to distributors like schools or educational institutions or insurances, something like that. So you have any input on what would be the first step that you would take or that you have taken?
I'll hop in just real quick. I think, so the care card, I think it's very cool. So psychological testing is super complicated. It's very expensive. It's a lot. And so I think it's really good that you're simplifying it and streamlining it, and something that I've hoped would happen for a long time. because it's good stuff. Like you can get people really good feedback, and people even like it. I mean, even though it's right now, it's like hours, right, and costly. So I think your idea of doing it fun, easy is good. Is it $2? If I'm the end user, let's say I wanted to have my kids tested, would it be $2 for me, $12 for me? What would it, or is it free? Like, how would it cost?
Yeah, it's depending on the test. So the initial test really is to actually check in on, is there something going on, like a general check-in? And from there on, we would then distribute further and saying, okay, you need to check in, maybe someone has a sign for depression or something, you need to go more into that direction. So if we look at the B2C model, then that would be from freemium into paid. So then we would charge them if they want to move more into depth testing. If we're looking at B2C models, then that would be more software as a service, where we would say we charge the insurance, or we charge an HR department a specific amount, and they could use the tests in specific amounts. Yeah.
At only 5 weeks in, my bias would be to try to open it up and make it as free as possible and engaging as possible for people to use and just learn. And you can pitch it to school districts, you can pitch it to parents, you can pitch it to all kinds of folks. You can work on social media, and then you can kind of see what segment or what segments are kind of picking it up, and that'll give you some clues. But rather than restrict it now, because you just don't know, I would open it and just try to focus on, how do I make this fun for people to do, and and engaging and interesting, because the need is huge, and if you can figure that out, it's going to be really good. So, but making it in a way for people to really leverage it and use it and learn it, I think that's critical.
Get users in there. Yeah, that makes
Arun,
sense. Thank you.
What's your take?
Yeah, I think it does diverge a little, like B2C versus B2B, and a lot of early entrepreneurs want to kind of hedge. And I think you do end up making, an implicit choice of the time, wherever you're spending your time is an implicit choice that you may not be actively making. So I think if you're going to go B2C, I wouldn't necessarily, B2B to C is just like channels to see. And like, I would do all the things you said, Glenn. I think on the other side, like, these tests are so expensive. They're so cumbersome. They're so inaccessible. Like, parents globally cannot get this stuff done. Even with means, resources, access, living in well-resourced cities, you cannot get this stuff done. And so I don't know, I wonder, like, why is this not just like, like you can go to the doctor and get a blood test and they can give you your full panel of my cholesterol and my diabetes and all, like why can't the insurance company just reimburse you for a test? And why can't that test just get ordered like 1 million times a day, like all over the globe? And that would be more of like a B2B kind of model, where it's like a blood test, or it's like the equivalent of like a diagnostic. And you can go get your $10 per test, or I don't know, whatever, you'll come up with some math, but like, that's more of like a B2B model. Cause if you invest in building those rails, figuring out the distribution of like getting that done will be the easy part. Like later, lots of drug companies kind of figure that part out later. So I do think you'll make an implicit choice one way or the other. I'm not sure in a couple of minutes we're qualified to give you advice to go down one way or the other. I would feel violating the do no harm, dynamic, but you're wrestling with the right issue. And I'd encourage you to keep thinking about it and try to make more of an active choice.
Thank you.
I'd like to ask a kind of general question that's open to anyone. I'll direct it to Aditi, Alan, and Anthony with Big and Mini first. I'm curious what during the pandemic have been the most effective or perhaps most unexpected or silver linings, ways that you found to help strengthen your own emotional resiliency, especially if they've involved technology. For me, it's been a combination of audio production software, then streaming across Twitch into Zoom yoga meetings that people around the world go to, which has been not something I expected at all to engage with prior to the pandemic.
Yeah, there's been a bunch of different things. I mean, some professors, I'm at UT right now, and some professors do like yoga with Yura Bali. So like the professors will teach yoga, which is always a fun experience. But for me, it's been really fulfilling to have a passion that I follow. So like to have Big and Mini and to be able to pursue this project. And then even like when we started out, we didn't know if we could actually benefit anyone. We were just like, we just want to help some people. Maybe we'll just help one or two, but if that's it, then that's worth it. So I think it's been following our passions and spending the time to help others. That's been really fulfilling and helping me get through this challenging time.
Yeah, I would say just even adding on to that, the fact that we've been able to just, even the conversations that we have with bigs and minis on our platform, whether that be through like helping them with technology or just talking with them after they send us emails and stuff. I think that's just been so fulfilling to hear their stories and just get to know someone new that you would have never really met otherwise. So that would be one of the things that's keeping me going.
Yeah, and I guess I don't want to take up too much time if we all answer, but one last thing is like, I think something in common with a lot of people, which is like being able to finally connect with people who are far away. Like it's almost like this time is an excuse that we can finally say like, oh, I'll hop on a Zoom or a FaceTime with you because like, I don't have anything better to do anyways. And so that's kind of like where we came from by starting Big and Mini too, is like, how can we take advantage of this situation to create more connection rather than less? Yeah.
That's awesome. Does anyone else, any other questions that we want to follow up with here?
Well, I was gonna say, building off of that, I thought it was great how the video call element is so like intrinsic to like what keeps us all going. And like, you kind of really need that human connection to like motivate you. I mean, I know when we're like kind of grinding at the code base late at night, it's really important that like Grant throws out a link and we all just kind of hop on a Google Meet and keep going at it. And then beyond that, like when we see like the feedback of like these big video calls of people who like request and reach out to us to like see a demonstration of the product, and then seeing their enthusiasm, they're like, oh, we're gonna go try this. Like that motivates us to also, you know, help develop the product a lot further. So yeah, it's just like when you get to actually get that golden gem of human interaction through the quarantine process, that's definitely a huge booster.
Definitely. You've actually just reminded me also of something that I experienced during the hackathon, which was the vast majority of the volunteers, Jonathan and I had never met before. And everybody was kind of meeting each other for the first time and kind of getting to know like, all right, this is what it's like working with you, and learning all of the things that come along with that. And that was an incredible experience. And so there's definitely something to be said about just exactly like this is the time, as Glenn and Arun have alluded to, this is the time to be thinking about these things where software might actually have kind of an inning in these areas where you know, revenue is going down, but also social connection is harder. And if we can jump in with technology that kind of makes these things easier, then we might be able to do things that, you know, in probably no other time we've been able to. Yeah, so I'm ridiculously excited about the impact of technology, and specifically mental health and what it can do for this space. Yeah.
Glenn, I thought you might find this amusing. The reason I had a crack a smile when you mentioned Taleb is because my girlfriend, who's listening in and among the participants, I asked her out on a date. At the very moment I journaled about asking her out on a date was when she revealed to me that The Black Swan was one of her favorite books, and she's currently reading Anti-Fragile. And that convexity has become the framework by which we choose how to order our next takeout.
Bold man. That's great. That's a funny coincidence.
That's awesome.
You know, just a quick comment. Congrats to you all. This is really much needed work. And Arun's a battle-hardened guy like I am. This is tough. So just know, like, as you're going through this, and it's really, really tough, you're doing it right. Don't think. It's not easy for anybody. This stuff it's some of the most challenging stuff you'll ever do. So just endure, persevere, grit, surround yourself with good people, you know, do all the coping skills, sleep, right? Get regular sleep, exercise, all that normal stuff that, you know, but just to say, it's tough for everybody. This is not easy. So just keep that in mind. Arun, any thoughts along those lines?
I totally concur. I mean, sometimes I look back at like our earliest days and be like, oh, it must have been so hard. And I'm like, I think the whole journey is just, typified by hardship. Like starting companies, willing these things into life, like you're constantly breathing life to your baby. Like it's, you'll have a couple good weeks and then just get a gut punch of a week. Like it's the finding ways, whether it's your co-founders, your team, your mission, the stories that come off of the work that we get to do. Like the beauty of working in these spaces is hopefully like you're seeing some of those user stories like coming back to you. And like, they just are, for me, they're so emboldening. But yeah, like this is hard stuff. I mean, starting companies is hard stuff. Starting companies in these spaces, these are spaces that really, it's a travesty that we've allowed these things to happen in our society. Like these are sad parts of our society that need real meaningful innovation. Like you're not working on, the latest TikTok dance or whatever, right? Like, these very social, fun kind of dynamics. So, you got to know that's the terrain, and it's okay to feel down. It's okay to take a mental health day. Like it's okay to ask for help from your co-founders. Like, this very, very, very normal, and you're endeavoring to do something really hard and really worthwhile. And, we need it, but, the world needs it.
I want to shoot one last question over to Kritika over at Care Cards. I was wondering if you could just share really quickly, what are the sort of benefits of early diagnosis that you're seeing and that you're excited about?
I think the benefits, Arun had mentioned it in the beginning as well. It is very similar to that, like early identification of any disease, not just mental disease, but especially in terms of mental disease. If you get to early identification of it, the prognosis of it could be more accurate, which leads to more effective treatment. It also helps people to not have other comorbidities, like other disease which could have if they had got the help later, like physical illnesses, the collateral damage, like to their families and stuff. So having the effective treatment on the right time due to the early identification can also increase their quality of life. And in terms of healthcare system, insurance, if people are getting treatment on time, having with the early identification, then it also reduces health cost, because then the health cost doesn't have to pay for the other disease which are attached to these kind of things due to the later help or something like that. And it also saves a lot of money to insurances. I mean, it's a closed loop. It gives everyone gain at the same time, but if you don't take an action at the same time, you all lose at the same time too.
That's awesome. So that's advice to the audience to, as well as us, to eat well, sleep well, but then also not be afraid to seek help when we need to, because sooner is better for everyone involved. And whether that's seeking social connection through Big and Mini, getting your diagnosis through Care Cards, or Open APA. I'm excited about all of the opportunities that these new software companies and projects present. I want to thank you all so much for coming to this. This has been absolutely amazing. There's going to be a slide coming up fairly soon with just general thank yous, as well as kind of next steps. All of this was put together with the help of the COVID Technology Task Force, which we're so incredibly grateful for having been a supporter of this event and wanting to do something about social isolation and mental health. John Borthwick, Rick Robinson, all of the early supporters of the hackathon, we thank you so much. Quarantine, thank you again for helping us operationalize the event. It's been incredible and we owe you so much. Slow Ventures for being the innovator of starting COVID Global Hackathon and allowing us to carry that torch. That was a very big deal and it matters a lot to us as well. If you're interested in seeing what else the COVID Tech Task Force does, we highly recommend following the Twitter account. There are plenty of initiatives across spanning mental health and education that we as an organization are looking into, and we're just trying to make a difference. And if you have an idea for how to do that as well, please reach out. I want to thank you all so much for coming again.